Mr. Chairman, thank you so much. And I want to thank each of you for being here. We had an insightful roundtable last week as we started looking at this issue. And to Tennesseans, this is an important issue, is getting this right. And Mr. Wadsworth and Dr. Lynch, I so enjoyed my few moments of conversation with you all. And Dr. Lynch, I think I want to come to you first. And when we look at OPTN and look at the Securing Organ Procurement, the Act, the bill would strip the nonprofit requirement for the manager of the organ procurement and transplantation network, which would open the door for profiting from organ procurement and donation. And to me, this is something that I think many people really fear, especially people that are on a wait list. And so what I would like for you to do is to address that and address those concerns and why or why not you think the Act has it right.
Thank you, Senator. I think it's unfortunate that people would be afraid of that, and it needs to be changed. Many of the patients that you reference are waitlisted at for-profit hospitals. For-profit is a part of American healthcare, and I can tell you that our not-for-profit entity, UNOS, doesn't work, and there are for-profit hospitals and for-profit transplant centers that do work. So patients don't need to be afraid of that. They do need to be afraid of the status quo.
Okay, thank you for that. Mr. Wadsworth, we've talked about the OPOs and what they could or could not do to follow HRSA's guidance on modernization, and you've talked a little bit about that. So when it comes to leveraging some of the modernization efforts and trying to enhance transparency, competition, and overall efficiency in the system, what do you see as the most vital steps that should be taken so that we're moving toward that goal?
For me, I think it's mostly around the data analytics, the business development of the organizations to be structured in a way that they can capture the most potential possible for the patients that they serve. And then also utilization of technology to then, for that application of it.
And then address the issue of patient privacy. And as you look at data and how some of that data that is captured and shared, and then how that moves into research, what is the importance of anonymity and privacy for those patients?
It's always going to be important to protect patient data, and it's personal. But if we can, there's ways to look at the data that blinds that, and it's still going to drive process improvement without having concerns of sharing something that shouldn't be shared.
Okay, Ms. McCarthy, did you want to weigh in on that?
I absolutely agree. Obviously, we need protection of our personal data, but right now, everybody hides behind that, or UNOS hides behind that as reason not to share with us information. In the context of waitlist accuracy, our PAC several months ago made a request for data around how many people are actually on the waiting list and whether it's accurate, knowing that 40% are inactive. We were told as recently as last week that we will not be able to see any future movement on that for no less than 8 months, despite it being anonymized data, but we were just completely told that we couldn't do it, despite coming in with the spirit and tooling to be able to find some opportunities to improve.
All right. Dr. Lynch, anything to add on that topic?
So the responsible use of patient data is a key part of healthcare research, and it's something that happens in other fields. This is something where we do take on the public trust to do that, but it's a recognized way to move forward, and saying that it's a stumbling block or an absolute no is simply false.
And do you fault UNOS in that regard?
I do.
Okay. Thank you all. Thank you, Mr. Chairman.
Thank you.